Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Senese, coming to you every Saturday at 10:30 a.m. Central Time. If you're watching us live, you can watch us on YouTube, Facebook, LinkedIn, X, and we added Kick, so you can even catch us there. So everywhere we're able to find our spot in social media, we're going to be there for you. Now, if you're visiting us for the first time, be sure to check out our website at UroPatient.com. Best place to learn more about the show. Also, best place to go and watch all the old episodes. We got a whole bunch of them there. And it's the best place to go and get our handouts, free handouts. What could be better than free? Going to see your doctor, download a handout, bring it along on your meeting. You'll be thanking me for it later. So we got a great episode for you today. Join us next on UroPatient.com. So today we're going to explore chronic pelvic pain in men, what it is, why it happens, and what you can do about it. So let's get started. Chronic pelvic pain in men is ongoing discomfort or pain in the lower abdomen, pelvis, or genital area that lasts for 3 months or longer. It's usually not caused by a clear infection or injury, which can make it really frustrating and confusing. The pain can come and go, or it can be constant, and it can affect your urination, your sexual function, and your overall quality of life. Even though the exact cause is often unknown, chronic pelvic pain is real, treatable with the right approach. I have to tell you that we see a lot of patients that are doctor shopping to come in and find somebody who'll take care of this because a lot of people just brush it off. It is real. Men with chronic pelvic pain experience a variety of symptoms, which can differ from person to person, like most symptoms. Common signs include a dull or sharp pain in the lower abdomen, perineum, that's that area like right below the scrotum and anus, testicles, or even your penis. Many men report discomfort during or after urination, and ejaculation can be painful or after ejaculation, or with your bowel movements. Some may feel a constant pressure in the pelvic region or have an urgent or frequent need to urinate, even when the bladder isn't full. Kind of like they think they have a urinary tract infection, often misdiagnosed as a urinary tract infection. Pain may also radiate to the lower back, hips, or thighs, and the symptoms often worsen with stress or long periods of sitting. Keep that one in mind. So the exact cause of chronic pelvic pain in men is often unclear, which makes diagnosis and treatment challenging. That's why one of the problems is because people are trying to, get patients in and out of the office, this takes time. In many cases, no infection. That's key because everybody seems to want to blame this on an infection. Sometimes it could be, but rarely that's what we're talking about in this case. No physical injury is found. However, possible contributors include inflammation of the prostate gland or other pelvic organs, nerve sensitivity or irritation, tight or overactive pelvic floor muscles, and past infections or trauma. Kind of think if you ever strained a muscle like your arm, you were lifting something and the next day, boy, it's just bothering you. So some of that bother can be strain in the pelvic floor muscles. I got a whole bunch of muscles that support that pelvic floor. Psychological factors like stress, anxiety, and depression can also play a role, either triggering or worsening the pain. For some men, the pain may start after surgery or after a urinary tract infection or some kind of an injury, but in others, begins out for no good reason whatsoever. So chronic pelvic pain can affect men of all ages, but it's most commonly seen in those between the ages of 30 and 50. That's why I got those kind of neat pictures of these, those guys over there. No, they're over there. Let's get this backwards. It can develop after a urinary tract infection, as I mentioned, prostate inflammation, surgery, or injury, but many men experience symptoms without any clear triggers. Athletes, men with high-stress lifestyles, and those who spend long periods sitting, such as those desk warriors who are always sitting at their computers, and heck, that's what I'm doing a lot of. And cyclists. My favorite sport is bicycling. may be more prone to developing pelvic pain. It affects men from all backgrounds, and it's more common than many people realize, often undiagnosed or misdiagnosed for years. Now, how do you diagnose this? So diagnosing in men starts with a thorough review of your medical history. That's key. A lot of times, people rush through and they don't get a good, solid history. You need to know everything, and don't hold back. Let the doc know what's causing this to happen. Make sure they got a good history. That's the key, and that's often missed. A detailed discussion of all your symptoms. You're not complaining. We need to know this stuff. Your healthcare provider may perform a physical exam, including digital rectal exam. That's the old finger exam when they check the prostate. But in this case, we also can feel these tense pelvic floor muscles. Sometimes a finger exam can reveal a lot. Even though it's a little uncomfortable, you can feel sometimes when these muscles are so tight. That's sometimes where the treatment comes in. Additional tests could include things like a urine test. Almost always we want to rule out an infection. Blood test, imaging studies, sometimes ultrasounds, MRIs to look for structural issues. Sometimes we want to make sure we're not missing something that could cause these same symptoms. Why, you say? Well, cystoscopy, a look inside the bladder. We talked about that, putting the scope up and looking inside there. You could have a little tiny stone in there in your bladder that's irritating it and causing the same type of symptoms. So there's other things that can cause these symptoms. You got to rule all that out. And get a good idea what inflammation looks like. Sometimes you can see some of the inflammation as you're going through the prostate. Often you can't. Because chronic pelvic pain has no obvious cause, diagnosis focusing on ruling out other conditions. There you go. And identifying patterns that suggest a pelvic pain syndrome. So it's key. You need to rule everything else out. Now, treating chronic pelvic pain usually requires a combination of approaches tailored for each individual. One cure won't fix everybody. So one of the most effective strategies is pelvic floor physical therapy. You never would think of that, huh? Which helps relax tight or overactive muscles, which may be contributing to the pain. Now, this is a specialist in physical therapy that works on this type of problem. You have to find the right person. You just can't go in and any physical therapist will do it. Most of them will tell you they don't do it, but there are some that have specialized in pelvic floor therapy, and those are the real geniuses. They know how to get those muscles to relax. And I can tell you, we've referred a lot of patients off to physical therapy and have had really good results. Another one that you don't always think about, the chiropractor. There's some specializing chiropractors now looking at this because they do the same thing with manipulating muscles and some of the pelvic muscles. We've had some good success. The key to this particular problem is somebody who's willing to think outside the box and try some of these other therapies. Now, medications such as anti-inflammatories, muscle relaxants, alpha blockers, nerve pain agents like amitriptyline and gabapentin sometimes can help manage the symptoms. I'm not a big person that likes to have patients on medicines. I don't think that's the best thing. Lifestyle changes. Now that I do like. Avoid prolonged sitting. Get off of that chair. Get one of those desks that goes up and down if you're one of those guys who's always sitting at a desk. Reducing your stress. High stress levels can trigger this. Staying physically active. Good exercise going to help everything. It's going to help a lot of things with your pelvic floor muscles. Posture. Are you sitting up in your chair, or are you always slumped over? Again, pelvic floor muscles can make a huge difference. Psychological support through counseling or cognitive behavioral therapy could be helpful, especially when the stress and anxiety worsens with the pain. So, it's a horse or cart thing. Who came first? So sometimes the pain will cause you to become depressed. Sometimes depression will help make those pains worse. So in complex cases, specialists may use treatments like biofeedback, acupuncture, trigger point injections. All these things are things that are done typically by physical therapy, except trigger point injections are one of the things that some trained urologists will do, kind of inject the muscles, or some interventional radiologists do that. The key is finding the right combination that works for you. Pelvic floor physical therapist is especially trained to assess and treat muscles, nerves, and connective tissues of the pelvic region. Got to stress that. You've got to go to a specialist who does this type of work. For men with chronic pelvic pain, these therapists might identify tight, weak, or overactive pelvic floor muscles that may be contributing to symptoms. Treatment may include gentle internal and external manual therapy to release those trigger points. These can be huge, huge pluses for people. Guided exercises that you're going to have to do at home to improve muscle coordination and relaxation, stretching techniques, breathing, even posture training, figuring out what you're doing wrong. They may also use tools like biofeedback. Biofeedback is electrical stimulators and things that give you some kind of feedback when you're squeezing muscles correctly or not. Sometimes they use units that have electrical stimulation to make those pain receptors go away. But they're going to assess that and help you learn how to properly control those pelvic muscles. The goal is to reduce your pain, restore normal function, and improve your quality of life in all respectful, private, and medically focused setting. These guys and gals that do this are experts. Several types of medications I mentioned earlier can be used to manage chronic pelvic pain, depending on the underlying symptoms. We try these things and see sometimes things like anti-inflammatories. That's your ibuprofen, naproxen, even Tylenol. They can help, relieve some muscle tightness. But again, long term, I don't like to see those used. Muscle relaxants such as diazepam, that's Valium, are sometimes even administered rectally to kind of get those muscles right there to relax. Again, I said out of the box. You have to think out of the box. There are some nerve type pain medicines that we use. We call them neuropathic agents like amitriptyline, nortriptyline, and gabapentin. All funny names if you're not used to them, but if you've taken those in the past and they haven't worked, at least you know. Key to that history, let us know if you try those in the past. Now, the other one that I have seen have some decent effect is something called alpha blockers like tamsulosin. Now, you may have heard of that one, especially on some of our other talks, because tamsulosin is often used to treat BPH or enlarged prostates. It helps to relax the muscles of the right around the prostate area where you urinate through. Relaxing some of those muscles may also relax some of those tight pelvic floor muscles. So those alpha blockers are usually, the nice thing about them is they don't have a lot of side effects. So it's a good one to try. We've seen some good results with some of those. In some cases, antibiotics may be tried early on, especially if there was an infection noticed or they didn't rule it out. Now, here's something that's been more recent is that we've now, in the old days, we did cultures on the urine where they sent it off to a lab. They put it on a plate and grew out to see if anything was there. A lot of times we got those back as no growth or too low growth. Not a lot grew. So you didn't really think there was an infection. Now there's this one, a couple of these tests that look at almost the DNA of the bacteria. And what they'll actually do is look at DNA structure and come up with a culture result from that. Sometimes we'll find organisms that were actually there, and it'll also tell you what they're resistant or sensitive to, so what antibiotic would work. And if you do really have a smoldering infection that nobody's catching, and they could find it, sometimes that is helpful. Again, you've got to try all these things to see. The thing I do want to stress is many patients come in and they say, hey, I know I've got an infection. I've had this for years. The other doctor gave me Cipro and I get better. No, you didn't get better because of the Cipro. Something caused the muscles to relax and you feel better. It's rarely are these infections. So don't get tied up in the chronic use of antibiotics. They have a lot of side effects. Starting with they cause resistance of other, when you really need them, they don't work. So, all right. Now, this is the key that everybody can do. Lifestyle matters. Making specific lifestyle changes can play a huge role in managing your chronic pain. One of the most helpful adjustments is to avoid prolonged sitting. I've got one of these watches, Apple Watches, and every hour it goes off and tells me if I've been sitting for an hour and haven't gotten up. Set an alarm. Look at how long you're sitting. Sometimes you'd be surprised. Just get up, walk around a little bit, get some exercise. Especially if you're doing a lot of sitting on hard surfaces, maybe you're not even sitting on a comfortable chair. If you like me to bike, and I love bicycling, be careful of those narrow bicycle seats. Not only can they cause prostate irritation and chronic pelvic pain, they also can cause erectile dysfunction. You can't get an erection. So 2 reasons to watch those seats. Now, I actually won't even ride on a bicycle like you see this guy, although that's kind of fun. I used to do that. I ride on one of these 3-wheel bicycles that's like sitting in I call it a lazy boy. So they call them recumbent bikes, and that's what I bought because I didn't want to have that problem. So precautionary, it worked out fine. I love still bicycling, and I'm doing great on that. But that regular pressure on the pelvic floor can cause this. Incorporate regular, low-impact physical activities like walking, swimming, gentle stretching, yoga. Yoga is being used a lot. One of my other podcasts that comes out on every Tuesday night at 7 p.m. is Dr. Jeff's Sex Talk. drjeffsextalk.com. You can check that one out. Go to our website. There's a link to his website from mine. But he's had some experts in yoga who have been talking about this yoga, certain exercises in yoga that are really helpful. Helps your sex life too. Practicing stress reduction techniques such as deep breathing, meditation, or mindfulness can also help. And, the namaste and ooh, and well, I don't do any of that, so I'm not going to try to show you. But they can help. Try it all. Now, here's one that we sometimes miss. I'm big one for this one. Stay well hydrated. And remember we did that talk about what foods and things could also cause overactive bladder? If you have one of these bladder that's sensitive, like irritants like caffeine, alcohol, spicy foods, all the fun things in life. Sometimes you got to cut those out too and see if that's what's causing it. It could be. Maintaining a healthy diet may ease urinary and bowel symptoms. Lastly, getting good sleep and building a consistent daily routine can support overall well-being and make other treatments more effective. A lot of research coming out about sleep and your health. They're saying, you need to get 7 hours of sleep every night. I was a bad one for that, but I'm trying to do better at getting my full sleep. So, chronic pelvic pain doesn't just affect the body. It can take a serious toll on mental health. Boy, oh boy, can it ever. I can tell you that these patients that are long-term, these are not something that you just come in because it's been with you for a few weeks. They've had it for years sometimes. A lot of times they're experiencing a lot of anxiety, depression, frustration. They feel isolated because they're always running to the bathroom, especially when the pain is invisible to others and it's difficult to explain. Some people, they feel like they're crazy. They're not. It's important to let patients know, and I'm trying to let you know, that these emotional responses are normal and valid. This is just kind of how we cope with this. Chronic pain is terrible. It's real, and even if tests don't show a clear cause, it's real. You've heard that now. So seeking help from mental health professionals, especially someone experienced with chronic pain or men's health, can provide valuable coping tools. There's some support groups, cognitive behavioral therapy, online communities. Bottom line is, don't take any of these options off the table. Mental health care is not a last resort. It's a vital part of healing. You don't have to face chronic pelvic pain alone. You're not alone. Don't face it alone. And if the person that you're seeing isn't being very sensitive to your problem and blowing you off, find a different provider. Chronic pelvic pain in men is a persistent condition that'll last months or years. While it can be frustrating, many men learn to manage their symptoms, and effectively over time, the pain, even though it may come or go, they just get to where they're having some periodic flare-ups. Often they're relieved from them because they know how to keep this down at a good level. So long-term, some men find the pelvic pain improves with proper treatment, lifestyle changes, and therapies like those pelvic floor physical therapists do, and occasionally medications. As I mentioned, I'm not a big one for keeping people on medications. I like all those other things much better. However, for some, the pain may remain ongoing and affect daily activities like mood and quality of life. It's important to work closely with your healthcare provider to develop a personalized pain plan that addresses pain, emotional health, and lifestyle factors. Support from specialists, physical therapists, and sometimes mental health professionals can help with coping and overall well-being. So while it can be challenging, many men still lead active and fulfilling lives by learning strategies to manage their symptoms and reduce those flare-ups. If the symptoms worsen or don't improve, a urologist or pelvic pain specialist can guide further testing and advanced care. I advise starting with your urologist. It's more common than you think. It's okay to ask for help. So if you see the number of people I have, I got 7 people behind me. 6 of them got blue shirts, 1 got a red shirt on. He's the guy with pelvic pain. And he's smiling, so he's doing better. But 1 in 7 men will experience pelvic pain. So it's not like you're a freak. Support is available. Treatments work. Don't give up. Don't give up. So, thank you for joining us today on UroPatient. Chronic pelvic pain can be difficult, often misunderstood condition, but remember, help is available. And you don't have to face it alone. If you or someone you know is dealing with pelvic pain, reach out to your healthcare provider for support and guidance. I hope that this episode has provided you with useful information, and I hope for managing your symptoms and improving your quality of life. Be sure to subscribe so you won't miss out on future episodes covering more urologic health topics. I also always have a handout. There's a handout on this, so go to my website at UroPatient.com to get that handout. And until next time, take care of yourself and know that you are not alone on this journey. You got me.